Dr. Altman, before you go in there, I just wanted to let you know that the patient, Blake, is transgender and uses he, him pronouns.
Thanks for the heads up, Joanna. I really appreciate it. Hi, Blake. I'm Dr. Altman. Nice to meet you.
Nice to meet you too.
I understand you're here for a wellness exam and a cancer screening. Is that correct?
Yes, it is. My mother was diagnosed with breast cancer earlier this year and has been asking me for a while now to come in for a checkup and to get screened myself.
I am so sorry to hear about your mother, but there's been great advances in cancer treatment in recent years. Survivors are living longer and longer. Do you mind if I ask you details about your mother's diagnosis?
I don't know all the details. She told me it's early stage, and that's supposed to be the good news. But it also has a BRCA mutation or something like that, which seems like bad news. In any case, she's been encouraging me and my sisters to go to the doctor to get tested.
First, I'd just like to acknowledge that you took the right step by coming in here today. People with a family history of the BRCA mutation have a higher risk for certain cancers like breast, ovarian, and prostate, and thus have to be screened regularly for these cancers. Early detection is critical. If it's okay with you, I'd like to refer you to genetic counseling to be screened for the BRCA mutations. If that test is positive and we find that you do have the mutation, we can then schedule you to do some additional tests such as a vaginal ultrasound to look for signs of ovarian cancer, which women with BRCA positive disease are at higher risk for.
Okay.
I'd also like to do a few routine screenings while you're here. First, I'd like to do a breast exam. Also, when was the last time you had a pap smear?
I'd rather forget, but maybe like 6 years ago.
Okay, so you're overdue for a pap smear. We can do that today as well. Would that be okay with you?
Dr. Altman, thank you for your recommendations, but I really don't feel comfortable with getting exam today. I would like to get the genetic testing, but I'll come back another day for the other tests.
Okay, well, schedule a follow-up appointment on your way out. Otherwise, I'll make sure Joanna gives you the information for the genetic counseling before you leave. If it's okay with you, I'd like to refer you to genetic counseling to be screened for the BRCA mutations. And if that test is positive, we can schedule you to do some additional tests, such as an ultrasound to look for signs of ovarian cancer. This is because people with BRCA mutations are at higher risk for breast, ovarian, and prostate cancers, among others.
Okay, I'm fine with that. Yeah.
While I have you here in the office, I'd like to do a few other cancer screenings. Would you be okay with the chest exam today?
Do I still need to do that? I've had top surgery.
That's a great question, Blake. Even though you've had top surgery, there is some remaining tissue, so there is still a risk for cancer. So if it's okay with you, I'd like to examine your chest.
Huh, I didn't realize that, but it makes sense. Sure, we can go ahead with the chest exam.
Okay, great. Do you recall the last time you were screened for cervical cancer?
I would rather forget, but I think it was about 6 years ago.
Okay, so you're due for a cervical cancer screening, but I think what I'm hearing is that your last experience wasn't positive. Do I have that right?
Yeah, that's an understatement.
Okay, well, how about we discuss an alternative? I can send you home with a self-swab kit. This will allow you to collect samples in the comfort of your own home, and then you can just drop off the sample here at the lab. The choice is up to you. We can do whatever will make you feel the most comfortable.
Thank you, Dr. Altman. I'd be much more comfortable with the at-home option.
Okay, I'll make sure Joanna gives you a kit before you leave, along with the information to schedule with the genetic counselor. Now, I'm going to step out of the room for a moment, and you can put on that gown, and we'll do that chest exam.
Okay, thanks.